Pathological narcissism, clinical and forensic aspects. Pathological narcissism is a personality disorder characterized by excessive self-admiration and attention. People with pathological narcissism are extremely self-sufficient and often believe that others should submit to their needs and desires. The disorder can have significant consequences both clinically and forensically. From a clinical perspective, pathological narcissism has been associated with several characteristics, including egocentrism, a tendency to seek approval from others, an inability to feel empathy, and difficulty maintaining meaningful relationships. Additionally, many people with this disorder have a distorted self-image, which often leads them to become dependent on the attention and approval of others. Some signs that may indicate the presence of pathological narcissism include a strong need for attention, an inability to accept criticism or admit mistakes, a tendency to take control of situations, and difficulty maintaining healthy and satisfying relationships. From a forensic perspective, pathological narcissism can have significant consequences in various contexts, including the legal system. People with this disorder may have difficulty respecting rules and may have a sense of superiority that leads them to behave dishonestly and violate social and legal norms. Additionally, many people with pathological narcissism have difficulty maintaining healthy relationships and may have a tendency towards manipulation, lies, and violence. For victims of pathological narcissists, it can be difficult to recognize the disorder and take measures to protect oneself. However, there are some strategies that can help protect oneself from pathological narcissists. For example, it is important to maintain some distance and not become too emotionally involved. Additionally, it is important to recognize the signs of the disorder, such as an inability to accept criticism and a tendency towards manipulation. In case of abuse by a pathological narcissist, it is important to seek help from the appropriate authorities and seek psychological support. Additionally, it is important to remember that the disorder is treatable, but requires long-term work on the part of the affected person. Cognitive behavioral therapy and psychodynamic therapy are some of the most common therapeutic options for treating pathological narcissism. In conclusion, pathological narcissism is a complex disorder that can have significant consequences both clinically and forensically. For those involved with a person with this disorder, it is important to recognize the signs and take measures to protect oneself and seek help. With the right assistance, people with pathological narcissism can learn to manage their behaviors and build healthy and meaningful relationships. However, it is important to remember that healing requires long-term commitment and each person with the disorder must undertake their own recovery journey. For those seeking help for themselves or for a friend or family member affected by pathological narcissism, there are many resources available. Mental health professionals, such as psychologists and psychiatrists, can help diagnose and treat the disorder. Additionally, there are support groups and online forums where people can share their experiences and receive support. Finally, it is important to remember that pathological narcissism should not be ignored or minimized. The disorder can have significant consequences on the mental health and interpersonal relationships of those involved. Taking control of the situation, recognizing the signs, and seeking help are fundamental steps to protect oneself and ensure one's health and happiness.